Hi, this is a video in a series about medical student resumes or medical student CVs. So if you're a medical student and you would like some help with your resume, you're in the right place. And look, even if you're not a student, you may find some of these tips useful. So please feel free to stay watching. Hey, I'm Dr. Anthony Llewellyn, the Career Doctor, and I'm here to help you manage your medical career. Now, one of the more unique issues with medical student resumes, and I should clarify, we are talking about the one that you generally put together at the end of your medical school years, the one you need for your intern application. See, one of the issues is it can be a struggle to show a point of difference in your resume at this point in your career. You might be lucky to have won some awards or have a higher than normal grade point average, but generally most medical students have the same types of experiences and learn the same things in medical school, so it can be really hard to stand out, or can it? So I recently gave a seminar to some fourth year medical students at my local university about the importance of being well-rounded in one's medical career and being able to demonstrate a range of competencies on your resumes. The framework I like for this is the CanMEDS framework. I've done a few more extended videos about CanMEDS, so I'll leave a link to one of those videos if you want some further details. But suffice enough to say, CanMEDS is a thoroughly well-tested model that basically says that we are looking for in a good doctor is someone who is not only a medical expert, but has strengths in the areas of communication, collaboration, advocating for patients and good health outcomes, scholarship, i.e. teaching, learning and research, being a leader, and of course, being a professional. All good so far when I spoke to my students about this concept. They could all see that there was more to being a doctor than their medical knowledge and skills. But, they asked me, how can we actually demonstrate that we have competencies in those areas? What are the opportunities we have between now and the end of medical school, graduation, where we can develop these other competencies more or demonstrate our proficiency? Fair enough question. So let's take one of these competencies. Let's take communication. I've deliberately chosen communication as it can be an extremely difficult competency to write about in a resume. Yet it's almost always there as a key selection criteria in jobs. Lots of doctors, not just medical students, will just write that they are a very effective communicator. But so what? Who says? Where's the evidence? Well, if you think about it for a minute, in medical school, there are plenty of opportunities to demonstrate your capability as a communicator and collect some evidence for your resume. You just have to be strategic and have a bit of a plan. Look, if you just rely on what the medical school says to learn, you're going to miss these opportunities that I'm now going to point out for you. Opportunity number one, communication training sessions. Most medical schools these days incorporate specific sessions or training around communication. Engage in these sessions. Find out what the curriculum or learning outcomes are for these sessions. Write these learning outcomes down in a logbook or a diary somewhere you can find. Go into these sessions with a specific goal in mind. If, for example, you feel that you want to work on counselling patients as part of your communication training, then tell the teacher of the workshop this is what you want to do at the start and ask if there's going to be a specific opportunity in the session for you to practice this aspect of your communication and get feedback. Write a short reflective piece about what you learnt as a reminder and a reinforcer. Now, when it comes to putting your resume together, you suddenly have something more substantial to write about. For example, as a communicator, I was trained by my medical school to be an effective and patient-centered listener and communicator. I learned the benefits and utility of various communication techniques, including both open and closed questions. I learned how to successfully handle difficult communication challenges such as breaking bad news or inquiring about suicide. A personal goal for me in all of this was to achieve high-quality counselling skills, which I'm pleased to say I was able to achieve so that I am competent in a range of counselling situations for interns, including discharge planning, the impact of lifestyle on health, and of course discussing common medications and their possible side effects. Opportunity number two, end of term reports. Most medical schools will require that you get some sort of end of term rotation or a supervisor report. Use these to collect feedback and information about your communication strengths and your weak points. I would encourage all medical students to start out each rotation again with a few clear learning goals in mind. If communication is one of these, make sure that this is clear to the consultants and the training doctors and other team members that you're going to work with. Be as specific as possible about what it is that you are working on and encourage them to be as specific as possible for you. So again, going back to our previous example, perhaps you want feedback on your counselling skills. Say this up front and your team will most likely help construct opportunities to practice these skills and give you some feedback. At the end of this rotation and others, you will then hopefully have meaningful comments in your supervisor reports. which you can now use on your resume. Check with your supervisor at the end of your term to make sure that you are provided with plenty of written feedback. Then, when it comes to putting together your resume, you have more to write about. For example, across my last 2 clinical years of medical school, my supervisor reports consistently showed that I excelled in communication. I was signed off as competent as being able to gather a relevant history, make appropriate file notes, complete an effective discharge summary, and conduct a handover and do a basic patient counselling session. Opportunity number 3. So, my final opportunity for you to both enhance your communication and demonstrate it on your resume might be seen as a little bit unorthodox than the last 2 suggestions. But I'd encourage you to consider this one. As someone who's interviewed thousands of doctors over time for various jobs, there are a few things that speak more highly about someone's impact as a communicator than actual patient feedback. Very few doctors bother to gather feedback from patients about things like communication. So there is a really great opportunity for you to stand out. Think about putting together a short survey or questionnaire for the patients that you are seeing as part of your rotation. Make sure, of course, that you consider issues of consent and privacy. It's probably best not to collect any demographic details or even case details at all. You just want the feedback around your communication. Whenever you see a patient, ask them if they wouldn't mind filling out this quick survey about your communication. Very quickly, you'll be able to compile a useful set of data and information that will probably show your areas of strength, which you can now point out on your resume, and areas for improvement. For example, during medical school, I also conducted a survey of 20 patients who indicated that I was an effective listener, was able to communicate in lay language, and that they would be more than happy with having me as their intern. So there you go. Some tips about how to talk about your communication on your CV or resume. Some of these you may be able to act on already based on existing data that you've collected. Some may require you to think about the remainder of your medical student days. Now, as I said, this will be a video in a series about medical student CVs and resumes. So, if you have a question or a comment about anything in this video, please leave it in the description below. If there are other topics around the medical student's CV or resume you would like to see me cover, then also leave me a comment down below. If you like the video, leave me a like. And if you like more than one, then why not turn on subscribe, turn on notifications, and liberally share throughout your social networks. And I will see you in the next video.